9 o'clock on the East Coast. You are with Denise Fuller, the NASNPRO of NASNPRO. And I am a licensed esthetician for almost over 26 years. And I am here with Stephanie Holvick. She is the owner of RN Faces. She is a registered nurse. And she was so generous with her time this morning because we've had a schedule change. Lucas from Malika, he's the director of education, had a family emergency. We're starting to send your prayers and love, keeping him and his family up in your prayers. But Stephanie is going to be talking to us today on how to help detect melanoma in the treatment room. Isn't that right, Stephanie?
That's right, Denise. And thank you for letting me pinch hit, and I'm terribly sorry about the circumstances today, but hopefully I can help out and bring some information to you guys this morning that you can use in your treatment room.
All right, thank you so much, Stephanie. Take it away.
All righty. Well, this is always a topic that I like to talk about. I like to help detect, not diagnose, melanoma in the treatment room. And it doesn't always have to be done with a DermLite DL100. But just to let you know, in the afternoon, my giveaway will be a DermLite DL100. This will help you determine whether you might want to send your client to the dermatologist. And if you're a professed skin geek, you will absolutely love this for many applications. And I'll get into some of them. But really, today's thrust is trying to detect melanoma so we can get our client to the dermatologist much quicker. So let's move along here. So I want to thank the American Cancer Society and the Skin Cancer Foundation because they let me use some of their visual effects, and they also encourage you to go to their sites, download all of the information so you can print it out for your offices. It's always great when your clients know that you're on the forefront of skin cancers and melanomas. So go to their websites as well after you see some of these images, and you can download them too. So today's objective, I want you to see how you can use your DermLite DL100, why it's super important to examine your client's skin. Duh, we all do that. But why it's really super important not to just be superficial about it, even when just doing what we think might be superficial procedures, even lash extensions or just a microderm. Those are the kinds of things we really want to pay particular attention to, and your clients will really feel like a rock star when you really dig in deep to see what their skin is all about. I'm going to show you the history of the DermLite, and this will come into play this afternoon when I'm giving away the DermLite. So pay attention, and some questions will be asked later today, and one lucky winner will win the DermLite. I also want to refresh you on the ABCs of melanoma, which we all go through in our aesthetic education and post-education, but sometimes we might lose sight of them or forget or say, wow, okay, I remember that. So the DermLite DL100. For those of you that don't know about the DermLite DL100, this is what we use it for, say, for instance, with the Skin Classic, but there's other applications as well. I'll go ahead and play this quick video for you to see. Whoop. There we go. I just wanted to stop it there. For what it's worth, for those of you that don't know what the Skin Classic does and keratosis treatment, we look through the DermLite so that we don't see capillaries in our irregularities. Those are no-nos for our estheticians to work with. This is a totally dry irregularity, and I just didn't want you to think that we were willy-nilly in treating these things in our treatment room. Oh. And it is included with your DermLite. for tattoo removal, you can actually see the depth. If you're treating hair in your area, you can see hair growth. You can see capillaries in the moles. That's just a fun one of a clogged pore, but very cool. Different things that we can identify, not treat, helps us determine if something is treatment worthy with our skin classic, or perhaps peels, or even cryotherapy. So that's just a few things that it does. But now derm light. What is a derm light? A derm light is actually repolarization of light. It came out in late 1999 and it has truly revolutionized the dermatology world. Every single dermatologist has one of these in their treatment room pocket all the time. They're looking through this for different irregularities, but what they're looking for mostly is melanoma. Melanoma is easily detected, not biopsied, but detected with one of these. So what we want people to do is to familiarize themselves. So it was the very first pocket dermoscope. And dermoscope treatments back in the day consisted of placing oil on the skin, a piece of glass. It was very messy until our friends in Orange County developed the derm light. And they're in Capistrano, California, a great company. So your derm light is made in the USA. When detected early, the 5-year survival rate for melanoma is 99%. And you can be part of that just by looking at your client's skin and certainly, again, not diagnosing, but detecting that something may be different. And let's just dive in and see how we can do that without a derm light. So we have some of our benign and malignant type of irregularities here. So I know we're probably all familiar. Again, download this feature. You can go to the American Cancer Society, print it off, laminate it, or contact them, and they will send you a poster. So these are super important for you to have in your treatment room as a reminder. But also, if a client sees this in your office, they're going to say to themselves, whoa, okay, she really cares about cancer, skin cancer. And you know what? I have something like on my side. Should I show it to her? And of course they want to because they feel like you're involved. So go ahead, take a look at these pictures so that you can see the differences between a benign irregularity and a malignant irregularity. And that doesn't mean you have to be right or wrong, but you're taking that extra time to look at your clients. For the easiest ways, asymmetry is very important, and also the borders being irregular. Colors in your irregularity could be different colors. That also is a telltale sign that maybe something is awry. Also, the size of your irregularity could mean something to worry about. And then if it evolves, if it grows, if it becomes bigger, if they see changes in it, those are all the things that clients need to know about. So placing a poster like this in your waiting room, your treatment room, so that clients can read this for themselves and do self-checks. I think it's something that we like to put the onus on our clients, and we can help them out. And we just went over all of these, and I'm just going a little quicker because this is a half-hour presentation, and this I can stretch out to about 45 minutes or so because I love talking about it so much. So you can go back in and see these slides because Denise is going to have these recorded. So if you feel like I am moving a little too fast, you'll be able to come back in and see some of these. So melanoma is a serious form of skin cancer that begins in cells known as melanocytes. And we all know what melanocytes are as estheticians. And so there's some facts that I think are worth noting, that only 20 to 30% of melanomas are found in existing moles. So when people have moles when they're young and they have them into their 20s, 30s, 40s, 50s, generally, they're not the ones that we're looking at as far as changing. It's more of those newer spots, things that pop up, things that weren't there. So those are very important to be looking at, more so than just regular moles that have been there. But again, worth noting that they're worth looking at as well. And hey, good morning, everybody. I'm so glad to see everybody here. Thanks for tuning in. Let's see. Okay, so it all starts in your treatment room, everyone. We all pretty much have mag lamps in our rooms. So you can be that junior detective by encouraging yourself to do full consultations, not just what type of skin they have, but to really go through their skin with a Q-tip and a magnifier or magnifying glasses. Look at everything that the client has on their skin before you decide to treat them for whatever procedure or even products you will be prescribing. You'll be able to see things that the client maybe didn't see on the side of their face. They will welcome that you took that extra time to look at them and point these things out. So make sure you start at least with a magnifying light or your magnifying glasses and a good task light. That's me on the right, and that's one of our great NASNPRO events. That was in Kansas. And Nikki is one of our Skin Classic trainers. She was actually looking at one of the spots on my face, which is a little bit more dermal and red. And we explained that during our presentation at the NASNPRO in Kansas. I so miss these events, but I think we have some live events coming up in 2021, so fear not. So another way for you to do this in your treatment room is to spot melanoma using the ugly duckling method. Now, as the owner of the Skin Classic, and we have a group, Thermolysis Skincare, and we have many Skin Classic providers in that group. Many people will submit a picture and they'll say, well, what do you think this is? I hate that. I have to know. Don't you want to know, like, not just what one thing is? If you're looking at someone's back, you don't want to zero in on one little thing. You want to look at the entire back of your client. And for me, looking at my people's backs, I want to see, does something stick out like a sore thumb? What does not belong? The ugly duckling method will help you decide if you want to take a deeper dive, a better look at what you're looking at on your client. And so we can all do that. If they have a lot of, say, cherry angiomas, but then there's one cherry angioma that's maybe bigger, uglier, maybe a little reddish underneath. Like, those are the things that you want to take a second look at. Say they have lots of brown spots on their décolleté. Most of them look about the same, but then you look at one and one just looks totally out of sorts. That's the one I want to take a better look at. I may want to go through my ABCs. I may want to look at it with my derm light. So those are the things that you can do in your treatment room with or without a derm light. So I want to go over this again just a little bit because it's super easy to do this in your treatment room. So the melanoma, it's the recognition strategies based on the concept that most normal moles on your body resemble one another, while melanomas stand out like ugly ducklings or a sore thumb. In my case, this highlights the importance of not just checking for irregularities, but also comparing. We want to compare what things look like. That helps us with our clients now and in the future. So the ugly duckling lesions are outlier lesions, and they can be smaller, larger. Also, any isolated lesions without surrounding moles, they could be compared to. So that was just a little demonstration down here, those 3 pictures of what an ugly duckling syndrome could be for you. So that's something to think about. And a self-check. So this picture, unfortunately, is just a little blurry, but this nice person had lots of, say, flat brown spots, maybe even some keratosis, but they had that one ugly duckling sticking out. So that's worth noting. Now, perhaps that ugly duckling might have been an injury. Maybe the client says, oh, I had a mole removed and it's still healing, but at least they know that you're looking at this. For you massage therapists, you see a lot of backs. So, and I know you run into a lot of keratosis and flat hyperpigmentation and cherry angiomas. So start looking at your clients' backs for the ugly duckling. Ask your client, I notice you have this red spot. Everything else is brown. Has anything changed for you? Maybe did you have a mole removed? Did you have anything done? Did you have an injury? So those are the things you can start asking your clients. And again, you're not diagnosing, you're trying to get to the bottom of whether you should say, maybe it's something that you want to see your dermatologist about. So we're going to get into some of what the derm light can detect when they look at melanoma. When you look at this, you could see the spot on the back. You can see it with your eye, with your naked eye. When you apply a derm light DL100, or there are other derm lights out there that they make, but this one is the most economical that I can put in my pocket and readily look at my clients' irregularities. But what this light does is actually it sends light down through the dermis and refracts it back. So you couldn't really detect those white areas, which is indicative of melanoma. So this helps you just to look at it, not scare your client, but if you know these types of things, you can say, that one might bear some looking at by your dermatologist. If you have these little nuggets in your head, you can certainly say that to your client without alarming them, but suggesting to them that they may see their derm. Did you all know that Bob Marley was diagnosed with melanoma? And he claimed at age 36. He got a dark spot under his toenail. He thought it was from a soccer injury, and eventually was diagnosed with the disease, but was not treated. His melanoma spread very quickly to the other areas of his body. His life was cut short. So see, he had that ugly duck syndrome. He had that spot that kind of came out of nowhere, and I guess that's something that he thought maybe it was an injury after a kick. Maybe you could get a bruise under the toenail that if it didn't go away with a month or 2 months, that's something that I would absolutely fear. So he had the ugly duckling syndrome, but unfortunately did not get the diagnosis early enough to save his life. So that's a very sad story, but ugly duckling story I think is worth noting. Some more different irregularities, again, from the ABCs. We're looking at asymmetry, different types of asymmetry. The borders are irregular, very irregular, and dished out in some cases. The color can be black, brown, but when red, even white. When you have multiple colors in these types of irregularities, that should be like a little red flag going off in your head. And the diameter, if it's bigger, and these are generally newer lesions that pop up, if it's more than 1/4 of an inch in diameter, it's worth noting that that client as well might need to be looked at. And I would say to my client, this doesn't look like anything that you've had, and it seems like it's new for you, right? You just said it popped up. So I feel like you probably need to be scanned at the dermatologist. Again, you know how I love the dermatologists. Make sure that you have a dermatologist in your back pocket. Have those business cards of your favorite dermatologist that can get clients in quickly. Maybe they're not your favorite, but maybe they're easy to get into so that your clients have a quick pathway to be seen by a dermatologist. Again, when you look with the derm light, you'll see these areas of white striations. Of course, with the naked eye, you would have seen all of the irregular borders and some of those black tips on the end. You'll see that in melanoma. And that doesn't mean that we have to like diagnose it again. We just want to help alert our clients. And I have 2 great videos in this slideshow that you'll be privy to that will help you really understand looking at that melanoma in your treatment room. And I urge you to really spend the time. They're about an hour a piece, not today because we have such a big NASNPRO day, but on another day looking at them. Dermoscope allows us to share these, and they're worth sharing for sure. We'll get into them. And then, okay, we have some ALM, melanoma, and these are most found in people of color. You could see all the white striations in there. So white is a big detection for you. So start looking at your clients a little differently. Again, a quick picture of a regular mole or a regular nevi. And then you look over at a melanoma. Look at the different little black little pebbles on the outside, very irregularly shaped. And you have that redness and white in the center. So again, it might be a little like overwhelming if you've not looked with a derm light, but you can see some of these differences as well with your naked eye. And that's how dermatologists operate. First, they look with the naked eye, and if it is noteworthy, they will get that derm light out and take a peek. See these nice blue areas that you can see on the right. Those are what you pick up with the derm light. On the left, it was regular magnification, which it looks nice and milky white. But when you look with your derm light, you'll see those absolute definite white striations, which was melanoma, and the doctors definitely will biopsy. Many of us have seen blue nevi, a blue mole, and that looks super okay, right? There's nothing going on there. But with a derm light and a different melanoma, a blue nevi that you think might be a blue nevi might actually have those white striations in there, and you would be able to be the detective that sends your clients to the derm. That would be a big win for you and your client. And guess what? Many of our Skin Classic providers in our group have sent many people to the dermatologist, and they had melanoma and they were treated and now they're fine. So again, this does happen more often than you think in your treatment room. Again, another slide of a regular nevi and what a melanoma can look like, spotted on the outside, some serpentine areas, and the nevi has all of those tiny little broken capillaries inside that we see every day with our derm light when detecting a mole versus, say, a keratosis. So there are algorithms, and these are different types of things you will see in the video that I will supply you with in just a minute. You'll see those white striations. You'll see the redness, the brown, obviously a melanoma. So this is something that you want to get familiar with, and you want to, again, extend this knowledge to your clients. You'll see some different things like dotted vessels and serpentine when together are melanoma. Serpentine when all by itself, like a mole, is not. Again, some more examples of the nevi and the melanoma, which you can go back and do this as well. I know we're running out of time, so I kind of want to move as quickly, but these slides are available. And guess what? If you want them quicker, in the comments below, say, Steph, I want the slideshow. And I'll message you the slideshow so that you will be able to get it quickly and start detecting the melanoma as soon as possible. Here are some more photos of the melanoma. Again, this is what the derm light will help you detect. Look at those white striations, all the different colors. This will help tremendously in your quest to search your clients for any type of melanoma. And how about yourself, your loved ones? It's something a good practice always likes to undertake. Again, some more pictures that are explained in the 2 videos which I have for you. So I'm not going to go through this because each of these are 1 hour long, but our friends at Dermscope, at the Dermlight, encourage us all to go through these. And these doctors that do this, the algorithm 1 and algorithm 2 are fabulous. I just want to show you how they'll show you what things look like, fully explain. It may seem a little complicated, but when you look at the videos and you listen to them and use it as a learning time, you will be able to more effectively detect this for your clients. Oh, and I guess that's a plug. My Dermlight DL 100 is for sale in our store at $249, but a little later today, you're going to see it at a NASNPRO price. I'm going to change that, and you're going to be able to get that at a lower price. But I'm going to pick someone later this afternoon, and someone will win this Dermlight DL 100. But I'm going to make it accessible for everyone, all of my NASNPROs. So stand by later today, and we might have one more question, 1 more minute for questions. So if there is anything that I can answer for you, let me get back in here. Please go ahead and in the comments below, go ahead and answer. How about that, Denise? I was right on time, wasn't I?
So right on time. You were perfect. And just so let everybody know, it is 12:40 Eastern Standard Time. Eastern Standard Time means that is Florida time. So if you are on the West Coast, that would be 9:40 a.m. So, but we're doing everything East Coast time because NASNPRO is a East Coast based company, and Stephanie will be returning at 12:40 to give away. What are you giving away?
I'm giving away the Dermlight DL 100, which nationally sells for $375, always on sale in my store, but it's going to have a NASNPRO price later today at $12.40.
So it's like a Cyber Monday exclusive, right?
Totally.
Awesome. Now, but in the end of the day basket, which you have to be registered to win, one lucky person is going home, and it's with this little thing that you donated. Can you tell us a little bit about this, Stephanie? What exactly is this equipment contraption? What do I do? Put it on my forehead? Will it make me smarter?
Well, it's actually an Avise red LED. So this Avise red LED is USA made, and it is super strong. If you had that on there, you really should wear goggles. They class it as a class 2 because of the brightness of the LED. So should be used at home with the goggles. It is it's self-monitoring. It beeps every 3 minutes, so you can get through a treatment in about 9 minutes. And you could do it while you're on your computer, or you could do it while you're on the phone watching TV.
How can I do it on the computer if I got the goggles on, Stephanie?
Oh, good question. Okay. Maybe when you're listening to your audiobook instead.
Or the podcast or the replay of this, right?
Exactly. And I did have a question. Somebody asked if the Dermlight was rechargeable. No reason to charge it. It is operated with a camera battery. And the Dermlight does have a 5-year warranty. So they're pretty bulletproof unless you drop it, but they're always helpful even if you do that. And lots of people wanted the slideshow. Awesome. I will get that to you, each of you. I'll get the link and send it right through here, and they'll be able to have it so we won't have to send it later.
Well, and Stephanie, you'll send it to us, and then we'll have it in the educational portal of NASNPRO.com.
Absolutely.
And you have other presentations, PowerPoint presentations in our education portal. So for those that are wanting to really get a plethora of education from all of our experts from conferences in the past, again, log into NASNPRO.com. It is free. It's a free membership, so you can access all that education. But we're going to see you back at 12:40, Stephanie, for the giveaway. Thank you so much for jumping in. We appreciate it.
Oh, absolutely.
For everyone else, We are going to gear up, so grab your pen and paper or go run get another cup of coffee, because at 10 a.m. Candace Noonan is going to be talking about how to treat ice pick scars. What does that mean? How do we do this? How do we really get those? Is there anything we can do, or do we need to send them to a dermatologist? Candace Newman is the national educator for Derma Concepts, the exclusive distributor from Environ. So get ready, grab your pen, paper, coffee. We will see you back at 10 a.m. If you haven't registered for these amazing giveaways, which we're having a whole basket full of various products in one basket, one giveaway, go to NASNPROtv, so www.NASNPRO.tv, register, because at 3 o'clock, we're going to cut it off, and then at 4:15, we're going to take a name out of the basket, and that lucky person is going to have a plethora of gifts and giveaways for the holidays. So we'll see you back at 10 a.m. with Candace.